So now let's look at those muscles that are moving your shoulder area, right? Or your scapula moving, or your arm. And so we already said the trapezius, your upper traps are flexing at the neck, but they're also doing a couple other actions. Your other parts of your trapezius, your middle, and your lower traps on the back right here are also inserted onto the scapula and are doing particular movements right here. Right, so for instance, your lower traps right here, when they contract, they're depressing the whole shoulder, bringing it downward, right, in this depression movement. Your upper traps, on the other hand, are doing the opposite thing. They're elevating the scapula, right? So your upper traps and lower traps are working against each other to form these, what's called an agonist and antagonist pair for each one of these actions. Right? Because they're, even though it's one muscle, they could be contracted independently of each other. So those are your traps, upper, middle, and lower traps. Let's see if we can, this is all isolated. You can see how it's attached up on your occipital bone. Goes down, some of it's on the front part of the clavicle, some of it's on the scapula spine right here. So, and then they're all starting from mostly your midline region right there. And so that's your traps. And then the other muscles concerning your shoulder girdle are going to, let's remove that. Underneath them, you're going to have your rhomboids, your major and minor rhomboids. When they contract, they're on the medial side here. When your arm is extended, it's going to pull it in toward, right? It's going to contract, pull it in toward the middle. And so those are your rhomboids. And then the other muscles moving your scapula. Over here, inserted on the top right here is your levator scapula muscle. Again, that's going to be attached up on your cervical spine, up on this sort of superior angle, and it does just what the name implies. Here it elevates your scapula, right? Shoulder elevation. I can't see it because the traps are in the way, but move deep to that, moving that elevation. So let's see, I'm going to go to pec minor later, but the last one that's inserted, right? So these are all inserted on the posterior side. These muscles right here that are kind of connected to the external obliques, making these serrated pattern right here are the serratus anterior. And they're going to be going below on the anterior surface attached from the ribs, on the anterior surface attached to the medial border over here, right? So those are your serratus anterior. And this is sort of making that, these are getting a little more difficult, but when they contract, right, they're going to kind of either pull the whole scapula forward like in a punching kind of movement, right, and also stabilize it from being pushed back too far when you hit something and your arm tends to go back, right? So this is your serratus anterior. These are called boxers' muscles. If you look at boxers or MMA fighters, they're going to have really pronounced serratus anterior. So, all right, so those are up for that's it for what I'm going to be talking about, movement of the shoulder, right? All those muscles that are inserting onto the scapula and moving that whole shoulder area right there. And then next we look at those muscles that are starting either from the scapula or the midline, inserting onto the humerus. So on the front, you have the pec major, the pectoralis major muscle. Right? This has this broad origin starting from the medial clavicle all the way down the sternum, some of your rib cage here, and then it wraps around and inserts onto the anterior surface of the arm right here. Right? So here's the bicipital groove, it's inserting onto there, right? So that when this contracts, this is a little bit more complicated just because it really depends on other muscles, what your position is, what it's going to do, but in general, we could look at it as a major shoulder flexor. Right? When it contracts, it's going to pull it up. Right? because it's spanning the anterior surface. And then it's going to be doing also this medial rotation, which does make sense, right? Pulling it this way, as well as this other one. Don't worry about the details of transverse, right? Because it's going to be moving adduction, moving it backwards, inwards when your arm is already out. So remember, for all these on your list right there, it says flex and adducts arm. That's what you can memorize, one or both. You don't have to memorize every single action for all these muscles right here. So just pick one that you're comfortable with and memorize that for an action. So that's moving your arm. Another thing, it's moving your arm. I got to actually hide the biceps. There's this deeper muscle that's starting on the coracoid process over here, inserting onto the humerus. This is your coracobrachialis, right? Coraco for the origin, brachialis for the insertion. And that's another little small muscle. That's a minor shoulder flexor. Or because it's kind of spanning the medial side, it's also going to help adduct the arm. Coracobrachialis. Then over here, your lats, your latissimus dorsi, you got this broad origin coming from the spinal region. You have this broad, what's called an aponeurosis, this broad tendinous sheath, and all up along the lower spine right here. And then it converges onto a little point onto the anterior surface of your arm, right? So it's coming from the back, but it's located, the insertion is on the anterior surface, right? So this makes it do, when you look at the action of it, what it's doing, because this is one of the ones listed, the extension and hyperextension movements right here. It's bringing your arm back. It's also doing this medial rotation, which is kind of weird because it's on the back right here, but remember it's inserted on the front of your hand right here, moving your shoulder, or like that whole lumbaral head, like in towards your chest region, pulling it back. So these are sometimes called the handcuff muscles because you're bringing your arm back and then rotating your shoulders in to get handcuffed. So those are a couple things for your lat, the latissimus dorsi. Also notice right here, this little muscle that's inserted around the same place as your latissimus dorsi. This is the teres major. Right over here, this is a synergist for the latissimus dorsi. In other words, it's helping it. Sometimes it's called the lat's little helper. Right? It's kind of initiating movements when this is in optimal position. But this is basically doing the same movements for the most part as your latissimus dorsi, your teres major. Just going down the line, you have your deltoids, right? Again, this is going to go all around the scapula. Let's see if they can show all night. So this anterior section is going to start on the lateral end of the clavicle. This middle section is going to mostly around the acromion over here. Right? So in complete anatomy, they actually instead of calling it the middle, they call it the acromial part. And then your posterior delts over here are going to be attached to the scapular spine right here. They all converge onto the deltoid tuberosity right here. But they, again, like the trapezius, are going to be able to act independently of each other. And so if you look at the action, they're all going to be acting with the lateral ones to do this. They're major shoulder abductors because they're spanning the lateral surface of that shoulder joint. But the anterior one, which is spanning the anterior surface of this joint, is going to be a major flexor right over here. But when this is contracting, your posterior delts are being stretched. Right? So your posterior delts are going to be, once it's flexed, it's going to contract and bring it back here down to the extension. It's also going to hyperextend it. And again, this is something you could feel on yourself as you move your arm in an anterior position. Bring it back to anatomical, and then start bringing it back forward, you could see, you could feel the differences in the contractions of your anterior and posterior deltoid muscles. All right, and we just went over the teres major for movement of the arm. And then you got your rotator cuff muscles, right? The rotator cuff muscles. So for this, they're a little deep, so we're going to hide the deltoids and trapezius, right? Remember when you learned about the supraspinous fossa, and the infraspinous fossa, and the subscapularis fossa? Well, those are all, the names of these muscles are going to reflect that, right? So you got your supraspinatus muscle, you got your infraspinatus muscle, and you also have this other small one over here called the teres minor, right above the teres major over here. So notice these three muscles are all going to be converging on around the same point of your greater tubercle, right, which is a little more posterior than the lesser tubercle. Right? So they're all going to have this same insertion point. And then they're all going to be, for these three, for one, they're going to be major abductors, or what's called lateral rotation, right? Bringing your kind of shoulder, rolling it backwards. Right? So those are your rotator cuff muscles on the back of your arm. And then you have your subscapularis muscle that's sitting in there deep. It's going to be coming from that subscapular fossa. This single one is going to be on the lesser tubercle over here. And then just because it's spanning the medial side, right, it's going to be doing that medial rotation. And that's one of its major functions. But the major function of all these are going to be counted to secure the humeral head into the glenoid cavity right there. Remember we talked about muscle stability. These are your rotator cuff muscles that are kind of holding in, stabilizing that shoulder joint right there. Right, so those are your rotator cuff muscles. You could remember about a thing called sits, right? That's your supraspinatus, your infraspinatus, your teres minor. Those are the ones in the back. And then your subscapularis on the front right there. All right. And then the last muscle over here that's coming off the rib cage right here is your pec minor. That's deep to the pec major. Right, and this is on your coracoid process right there. You don't have to name an action for this one, but it's going to downwardly rotates your shoulder girdle. So that's your pec minor, and there it is on a person. All right, so next we're going to look at these muscles that are moving, the humerus as well as the elbow flexors over here. So let's start with our biceps brachii, right? You have this long head, which is going through that, the tendon is running through that bicipital groove, inserting on the supraglenoid tubercle. And you have the short head, which seems longer, inserting onto the coracoid process. They're both merging onto the, I don't show it there, but they're inserting onto that radial tuberosity. Inserts onto the radial tuberosity. We also have what's called this bicipital aponeurosis, you'll see, that's moving around here and helping secure these, but this is your insertion point. And so the thing about the biceps is they're spanning both the glenohumeral, the shoulder joint, and the elbow joint. So they're going to be having actions at each of those joints. Right, so one of their major things is shoulder flexion. He's bringing it on the front of your arm. He's bringing it in an anterior position. And it's also spanning your elbow joint. So it's one of your major elbow flexors, right? And that's also going to be assisted here by your brachialis muscle and your brachioradialis muscle. And so these are all your elbow flexors So those are all muscles. Where are they? They're all on the anterior surface of your arm. And if they span both joints, they're going to do shoulder flexion and elbow flexion. And muscles like your brachialis, which starts on the humerus and inserts on the ulnar tuberosity, is also one of those starting up on the humerus. It's also going to be one of your major elbow flexors, but doesn't do anything at the shoulder. So those are on the anterior surface of your arm. On the posterior surface of your arm, you basically got your triceps. Triceps, posterior surface. One of the heads, you don't have to know the individual heads, but one of them is up on the scapula, on the infraglenoid tubercle. Both of them merge on this broad tendon area right here to insert onto your olecranon over here, right? So because this part spans the shoulder joint, that's going to be doing shoulder extension and hyperextension. And it's also going to be doing elbow extension. So this is flexion, being stretched, now it's contracting. So this portion doesn't do anything with the shoulder, but both of them do this elbow extension. So those are muscles around on your brachial area. And then we're going to start looking at wrist, flexors, and extensors, right? So the same pattern is going to be involved right here. Remember, this is your brachial radialis. This one goes from your brachial and it inserts on the radius bone. It doesn't span the wrist joint. All these other muscles on the front of your arm, right over here, are going to span the wrist joint. And they're all on the anterior surface of the arm. And then on the back of your arm, you're going to have your extensor compartment that are going to be doing those wrist extension and wrist hyperextension. Just note that they're all coming off, all your flexor muscles, wrist flexor muscles are all coming off the medial epicondyle, whereas your wrist extensors are all coming off the lateral epicondyle. In the naming, let's just look real quick at some of the names. Flexor, carpi, radialis. Flexor, meaning it flexes. Carpi, meaning the wrist area, so it flexes the wrist, and it's along the radius side, right? Remember your thumb and your radius are on the lateral side right here. So your flexor, carpi, radialis is a muscle that flexes at the wrist and is on the radial side, as opposed to your flexor, carpi, ulnaris, which is running alongside the ulnar bone or pinky side, and it's also going to be flexing the wrist. Right, so these are some of your major wrist flexors. You also have this one, which in the middle between those two, your palmaris longus, going down to the palm area. And then you also have deep to these two, this big flat muscle here. It's extending out to the digits. That's your flexor digitorum superficialis muscle. And you know that by the tendons, which are going out to the fingers right there. And then the last muscle up on the forearm right here is your pronator muscle. And again, that's going to be doing that pronation movement, right? Supination, pronation, supination. So it's connected over from your medial epicondyle onto the humerus to make that twisting movement. And then all your extensor muscles. So you want to kind of maybe go around in a circle, maybe starting from the pronator teres. Right, here's the separating compartment. Your brachioradialis is the most lateral one. Then you got your pronator teres, flexor carpi radialis, palmaris longus, and your flexor carpi ulnaris. And then when you go to the other side, so you notice your flexor carpi ulnaris kind of sticks out the posterior side of your muscle, but this is your ulnar bone. On the other side of the ulnar bone is your extensor carpi ulnaris. And so they're right next to each other, one spanning on each side of the bone. And then you got your extensor digitorum going out to the digits. And again, you can see how the digits, how the tendons go out to the digits right there. And then you have your extensor carpi radialis. And there's two right there, but don't worry about differentiating between them. It's just if it's the one next to your extensor digitorum and your brachioradialis, it's your extensor carpi radialis. So now we're going to go that was all your arm stuff, right? So again, just go around these ones seem tricky. Just go around in a circle, starting from whatever your point is, the dividing lines for your extensor and your flexor compartment, or really the brachioradialis on the lateral side, and then your ulnar bone on the other side, right? Because that bone is going to be separating the flexor carpi ulnaris and your extensor carpi ulnaris. So all those muscles that span the wrist on the front side are going to be doing that wrist flexion movement. Wrist flexion. And then the other thing, while we're here, notice that the flexor carpi radialis is spanning the lateral side, right? It's on the thumb side. So it's also going to be doing this wrist abduction movement, because it's spanning this side. When it contracts, it's going to pull the thumb outward away from the body from anatomical position. And then the other thing, usually your flexor carpi ulnaris and your extensor carpi ulnaris are in opposition to each other during that flexion and extension movements. But when we're talking about wrist adduction and abduction, they'll be kind of working together, right? Because the flexor carpi ulnaris and extensor carpi ulnaris are both spanning the lateral side of that. The same thing be true with your ulnaris, your extensor and flexor carpi ulnaris. They'll be doing wrist adduction. Now we'll move on to your hip movement right here. Let's remember, this is doing trunk. It's not any kind of hip thing. So we passed over this big muscle last time when we were looking at the spinal flexion. This muscle, your psoas, does do some spine flexion, but it's one of also your major hip flexors. Right? These two muscles are referred to as your iliopsoas muscle. This is your psoas. This is your iliacus. They both insert onto the lesser tubercle. Over here, they're going through around this pelvic cavity to insert on the lesser tubercle. Right here. So when they contract, they'll be doing that hip flexion, bringing that hip forward right here, right? So if you're a yoga person, you probably know about the psoas major. Is one of those really core muscles that are involved in like good overall body strength, right? Your psoas major. So while we're on hip flexors, let's look at some of your other major hip flexors. This will be your rectus femoris. And this is going to start up on your inferior superior iliac spine, insert onto the patella tendon, which is going to insert onto the tibia, so that's going to cross the knee joint. And again, that's going to be one of your major hip flexors, but it's also part of your major muscle group on the front, your quads, right? Which are going to consist of your rectus femoris and your two vasti muscles, your vastus medialis and your vastus lateralis. You also have a vastus intermedius underneath here, but we're not going to worry about that. So quads means four. The fourth muscle is the one under there we don't have to worry about. But these are your quads on the front of your leg. The only one that spans the hip joint is the rectus femoris. The other three are going to be inserting all onto the patella tendon right there, which is going to move the knee right there, right? So while your rectus femoris is a major hip flexor, all these, which are going to move the knee, they're going to extend the knee, right? So they're on the front of your leg, but because we're talking about the knee, they're going to be extensors. So your rectus femoris is flexing at the hip, but it's extending at the knee because of this reversal down. So those are the quads that you have to know, right? And then going straight across here, right? Let's make this strap-like motion starting from your anterior superior iliac spine. This is the longest muscle of your body, inserting onto the medial side. Yeah, it does a couple of complicated things because the way it spans and it crosses over. Right, so it does hip abduction, knee rotation, which is a weird one, hip flexion, lateral rotation. Right, so just pick one of those that's on your list to remember, right? The easiest one is probably hip flexion. That's your sartorius, right? Span kind of crossing. Look at this cross. Sartorius means tailors. So when you cross your leg, you put it in a sitting position like that. That's the action of the sartorius. So what other muscles we got on the front? Let's go toward the back. Let's go on the back first before we go to those medial muscles. You have this one running down your iliotibial tract, like this broad tendon that's going to insert below the knee right there. It's always a good marker if you're looking at one leg to know that this is the lateral side. So your tensor fasciae latae on the lateral surface of this joint, inserting onto that IT band right there. Right? That's your tensor fasciae latae and your IT band right here. That's not a muscle, that's a tendon. But the gluteus maximus also partially inserts onto that IT band right here. So your gluteus maximus is one of your major hip extensors. All you have to do is think of those buttmaster machines or something where you're kicking your leg backwards like that when it contracts. And then your other major hip extensors are your hamstring muscles. Right? These are your biceps femoris on the lateral side here, your semi-tendinous muscle, and then deep to the semi-tendinous, you have a semi-membranous muscle. Right? So when you think of your quads, you could think of the rectus femoris and your vasti muscles, lateralis and medialis. When you think of your hamstring muscles, you could think of your biceps femoris and your semi-muscles, right? Semi-tendinous, semi-membranous. And the way you might remember which one of this is which, your biceps is lateral to your semi-tendinous. So I say BLT, biceps lateral to tendinous. If it's one leg, you'll want to look for this IT band. That's a dead giveaway that you're looking at the lateral side right there. All right, so those are all major hip extenders and hyperextenders because they're starting. All of them are starting up around the ischial tuberosity. You know, they're inserting a little bit, but they'll all eventually insert below the knee right there. So all of them are going to be action both at the hip joint, extending it, just along with the glutes right here. But notice they're also, because they're all crossing the knee over here, they're also going to be bringing this up, which is a flexion movement. Right, so they're going to be extending at the hip and flexing at the knee. So those are the on the front, your quads, on the back, your hamstrings, and then on the inside, you got your adductors. Now, you really don't have so much in the way of abduction movement. Your tensor fasciae latae does a little bit of this hip abduction because it's on the lateral surface of the joint right there. And your actual one I forgot here was your gluteus medius over there. It's also spanning the lateral surface, a little bit of hip abduction. But all your adductor muscles are on your inner thigh right here, right? So you got this big one over here, your adductor longus on the front of your leg. If you look at the back of your leg, you have your adductor magnus muscle. These are two of your major adductor muscles that you have to know. Now this one, your adductor longus, and then on the back, your adductor magnus. Running most medially, this long one going down the side here is your gracilis. It's your most medial muscle, most interior surface right there. So if you want to go from medial outward right here, the ones you have to know. You got your gracilis, your adductor longus, pectineus. So those are your gracilis, your adductor longus on the front, and then your adductor, you want to start again from your gracilis, your adductor magnus on the back. And they're all doing adduction movement, right? Bringing your leg back in towards your body. And then now we'll get down to the lower leg. We're almost done here, right? Let's look on the anterior surface. These are all ones that are going to be, depending on where they're spanning right here, moving your foot right here. So remember we said the foot movement in the upward direction is called the dorsiflexion movement. And that was really more what we'll consider an extensor movement. And the way you'll remember that is that one of these muscles, right, that's going down to the digits, just remember like your extensor digitorum on the back of your arm is going down to the digits. Your extensor digitorum longus muscle is going down to the digits of your foot here. So on the front of your leg, the other muscle, major one going right down your tibia, right here on the anterior surface of your leg is your tibialis anterior muscle, right? So this will also be one of those what's called dorsiflexion movements, right? Bringing your toes upwards right there. Dorsiflexion, even though we'll consider it an extensor because of the extensor digitorum, and it's on the front of your leg, just like your quads with this knee extension are on the front of your leg. So you go around, you got your tibialis anterior, your extensor digitorum, which you'll be able to tell because they're going to run down the digits right here. And then you got one that's running alongside your fibula right here, which is your fibularis longus muscle. Right over here. This one, because it's running along the lateral side, it's going to do this movement called foot eversion, which is really kind of a abductor movement. Right here, right? This fibularis longus, and moving it out. You can call that movement, she is calling plantar flexion. It's still going to also plantar flexion, even though this one doesn't have it. All right, so those three muscles, right? You got your anterior, tibialis anterior, your extensor digitorum, and then your fibularis longus. Right, these are all kind of seen from the front or lateral view of that. And the fibularis longus is running inside the fibula. Tibialis anterior is running along the tibia, and in between them you got that extensor digitorum. And then on the back, you got the two major calf muscles. Right over here, your gastrocnemius. Over here, this is spanning the knee joint, so it is causing knee flexion. Imagine when it contracts here, it can pull up this. This is more of a movement when your foot is planted. But your other thing it's going to do is this plantar flexion movement. Contracts, it's going to bring it down to that tippy toe position. And then the other muscle doing that, deep to that, is called, oh no, don't worry about that one, your soleus muscle, which is running deep to that. So this one inserts below the knee, so it's just doing that plantar flexion movement. But these two muscles, gastrocnemius, soleus, are both merging onto your calcanean tendon, your Achilles heel, right over here. They're both inserting on that to do that plantar flexion movement. All right, so now we're going to get into the deep muscles of the hand, each individual one. No, I'm just kidding. We're not doing any of those muscles. We're done with all the muscles that you have to know. I don't think I missed any. And those are the major actions of it. So remember, try not to get focused on memorizing every little detail. Try to remember the general principles of those flexor, flexion, and extension kind of compartments. You'll see them also. If you look in the medical literature, you'll see these flexor compartments, extensor compartments, right? And you'll see All the flexors are going to be on your anterior compartment, posterior compartment. These are all kind of grouped together. And then abduction, adduction. So try it as much as you can. Learn by principle so you don't have so much to memorize.